First of all, it's important to point out they are a unique breed. So within the European Union, only about 2% of all veterinary surgeons would have the designation of specialist status. Technically speaking, it is something that is legally privileged. So in order to actually be nominated as being a specialist and be on the register as such, you have to have undergone a period of intense training. And what this will normally involve is an initial internship followed by a defined residency training within that skill. All of it is overseen by the European Board of Veterinary Specialization, and there are all these constituent colleges. Could be small animal internal medicine, could be cardiology, could be anaesthesia. So within the different disciplines, they do in-depth training. They've got a lot of examinations which they have to pass, initial ones and then final certifying ones. And once they get that status, then they have to maintain it. And that involves regular CPD and regular attendance at conferences so they stay on the register. But specialists, although they're rare in number, have a hugely important role to play within the veterinary profession. In relation to what kind of specialists are here in UCD, I start that and pivot the questions, what do we not have? We're very, very fortunate in that we've got people with a huge, vast spectrum of interests and specialist qualifications. So there's over 35 colleagues here at the moment who do have EU Diplomate specialist status, and they cover a whole range of specialties, again from small animal internal medicine to large animal internal medicine to equine to cardiology to dermatology and anaesthesia. In virtually every clinical discipline we obviously have a diplomate. Now the point is that many cases initially can be seen by your vet in practice, and they're hugely talented and highly professional. But sometimes to take it a step further, particularly with a complex case, one that's either difficult to diagnose or difficult to treat, just like in the hospital, you refer on to a consultant. And these specialists really would be at consultant status, so they can take it a step further. Normally, again, obviously with colleagues in other related disciplines that they can rely upon for further advice. And of course, you need very often specialist equipment or access to that equipment as well. So the reason why specialist care is essential is that it's great that many animals get better, either with primary care or sometimes really with no intervention at all. But the truth of the matter is, just as in human medicine, when the case is serious or it's complex, the outcome, of course, can be very, very problematic. And that's one thing we're very keen to obviously avoid. So what we normally do is we receive a lot of referrals from our colleagues in practice who simply say, look, I need an expert opinion here in this heart case, or it's a very complex spinal fracture, and I really would like a consultant to actually deal with this. So the kind of cases we see are in small animal, large animal. They involve all the specialist areas such as anaesthesia, diagnostic imaging. And the beauty is when you have like-minded colleagues, just as in a human hospital, instead of just being one person trying to solve the entire puzzle themselves, there's a group of people. Accompanied as well by paraclinical specialists. And by that I mean pathologists, clinical pathologists, microbiologists. So when you get that kind of roundtable discussion going and everybody's able to chip in with their expertise, it's quite amazing what you can achieve. And I think everybody realizes in veterinary medicine these days, some of the outcomes can be really very, very, very dramatic and rewarding compared to what they were 20 or 30 years ago. And that's the real role. That's where the real value comes in from specialist input. So in the rest of this video, you're going to hear from many of my colleagues. These would be specialists within the different disciplines. They talk about the kind of work that they do. They talk about how they work up the cases. And equally importantly, they talk about how they actually share that knowledge with the other specialists in order to get the best outcome for all the animals we treat. And finally, of course, this is a huge role to play in the education of the future generations of veterinary surgeons and veterinary nurses.